Hello, everybody, and welcome to this edition of MacroPro and Friends webinar series. Today, I am joined by Adam Thomas of ISIS. Adam, how are you doing?
I'm doing well. How you doing?
I am fantastic. It's so nice that we're here in spring and getting ready to have summer at our doorsteps. I'm looking forward to that. So, Adam, can you tell everybody what you do for ISIS?
I am the regional manager of customer relations. So I've been with ISIS for going on 16 years. And so I oversee parts of California, Nevada, Arizona, New Mexico, and Texas.
And then what does ISIS do?
ISIS provides nurse case management. So we are family owned and operated. We are in California, Nevada, Arizona, New Mexico, and Texas. Our speaker today, Angie Jung, is our founding nurse. Angie's been in the case management world for 30 plus years, so it's great to have her as one of our resources.
Okay, so before we bring her on the screen, and I want to do some housekeeping, but you and Angie are going to do something fun today, right? So can you tell our audience what you're going to be doing so they can be prepared?
We are. So we will have several quiz questions throughout the presentation today, and we want to reward whoever answers the quiz questions correctly. So we will be sending out some Amazon gift cards to the winners, to the folks that answer the question, the trivia questions first.
All right, and so first would be based off of what you see on your screen, because not everybody's screen is the same. So
Yes.
we want to make sure that everybody is aware. We will pick the first person that gets the right answer and on Adam's screen. So before we get started, Adam, I just want to do a little bit of housekeeping for everybody. Today's presentation is worth 1 California CEU. You will receive that in your email. If you don't receive that, or if you received it, you're going to get a notice as your certificate has arrived. You got to click a little button, and then the button, there'll be a little wheel that spins. So it might take a little bit to download, but it will eventually download. If it doesn't, please try a different browser. And if that doesn't work, please contact your IT department, because it's probably a firewall or something along those lines. I do need to say that you need to be logged on to GoToWebinar on your phone or iPad. You can't just phone in. If you just phone in, there's no way for them to get your time and attendance. You have to actually be logged on. All right, so now that we got that, if you have any questions for Angie, you're going to be putting them inside of the GoToWebinar control console. And there's a little box that says questions. So you can ask your questions, and that's the same place that you're going to be answering questions. And Adam and I will be watching that box so that we can ask Angie any questions that you may have. There are handouts that are attached to this webinar underneath the handout portion. Please make sure to download those now, so that you can refer to them after the webinar, and you can make any notes you would like during the webinar so that you have them handy for you. And lastly, there'll be an encore performance of this on the MacroPro YouTube channel. We've got lots of great education for you there. And for those of you who don't know, I'm Diane Cohen with MacroPro. I'm the Vice President of Client Services, and we are a document retrieval company. We get records for your litigated and claims files. Doesn't matter where they're at, including other countries. MacroPro will do everything in our power to receive and get those records for you. Okay, Adam, I'm going to let you introduce Angie. So, Angie, go ahead, Adam.
Our speaker today is Angie Jung. She is a nurse case manager by background, and she has transitioned into doing a lot of our educational topics that we do. She writes all of our curriculum, and she's one of our presenters. Angie has been a nurse case manager, like I mentioned, for 30 plus years. She is based in the LA area, but she has kind of service throughout the state. If there's any questions, we'd love to have this topic and presentation engaging, so please feel free to ask any questions so Angie can answer them while we're doing the presentation. Angie, I will hand it off to you.
Thank you, Adam. Thank you for the introduction. And thank you, MacroPro and Diane, for having us here. Okay, so we're gonna have some fun stuff going on, and we're gonna talk about comorbidities and the impact on workers' compensation. When you hear the word comorbidity, and feel free to type it, practice your response in the questions, right? Because you're gonna wanna respond to these quiz really quickly. So let's practice this. When you hear the word comorbidities, what comes to mind? Anybody? Feel free. Ah, very good, Wendy. Thank you. Yes, obesity, pre-existing. Oh, very nice, you guys. Oh, I love this. I'm looking at all
Coma.
the responses.
Yeah, there's a lot of responses here.
Oh,
Underlying
high blood pressure. Look at you guys. I think we got some
condition,
pros. Yeah,
HE, diabetes, hypertension.
yeah. We got some pros here in this group. Okay, so is it important for claims management to identify comorbidities condition? Of course, right? Because they often require some additional medical care or treatment, or it could be an aggravation of an underlying condition. And we know that comorbidity is associated with worse health outcomes. There's more complex in terms of your claims management, depending on what it is. Obviously, there's always a concern for increased costs. And as claims professionals, we should always and constantly, we always do anyway, is to strive for opportunities to be proactive and reducing workers' comp costs and improving outcomes. So it is important for us to kind of look at addressing comorbidities and even taking a step further in today's conversation of kind of developing even a healthier workforce. Okay. So I am just so glad Diane had invited us here and chosen this topic. And so I think this is a really important topic. So every time when I talk about this, I always feel like, oh my God, are we opening up a Pandora's box here? So that's why I put the picture, because I do feel like that. So we're going to define comorbidity. We're going to identify the impact of comorbidities in the healthcare and in workers' comp, recognize some of the common comorbidities and how they interfere with work injury and recovery, and then some of the claims implications and strategies to improve outcome. So what is comorbidity? So the word morbid comes from the word disease. Okay, so of course, since then, it's this combination of that, and it could be, well, how it's really defined is one or two or more. My apologies, two or more diseases or mental conditions that is coexisting in the same person. Now, there's really, and the substance abuse and mental health services actually add in the component of not just physical, but also consider some of the mental comorbidities, right? And the other thing is, it really doesn't matter if it's before or after the injury, because or any kind of chronological order in terms of comorbidities. So we talk about chronic, it's often chronic or long-term, and chronic is a disease is considered chronic when it is persistent, and at least maybe something more than a year, or require ongoing medical attention or treatment, and even maybe some degree of limitations in their activities of daily living. So of course, the concern is with comorbidities, it may accelerate or exacerbate other conditions. And sometimes we even call it multiple morbidities if there's more than one. And so there's always some additional expenses concerned in there. So disorders, illness, health, or psychosocial problems. So here are some of the stuff, and it's certainly not an inclusive list. So you guys already named all that: cardiovascular, hypertension, a high fat content in the blood, diabetes, COPD, chronic obstructive pulmonary diseases, arthritis, obesity, digestive disorders. Okay, so that's a lot of the medical stuff. But we don't want to forget that there's also the psychological component of it. Maybe history of depression, stress, anxiety, and some kind of psychiatric disorder or substance use disorder, personality disorder, even lifestyle and psychosocial. What I put here in the middle is that we don't want to, we want to be mindful that any of this the age component is important. And especially with our older workers, and there is a greater concern, is because that they take a longer time to recover. So it could affect every system, and of course, as the aging worker, then it also interferes with a return to work, other expenses. In workers' comp, though, even a minor injury can escalate to a chronic condition due to comorbidities. I am sure that many of you have seen that in your cases, right? So, for example, I had a bus driver. He scraped his shin. He scraped his shin as he walked up the steps of the bus. Now, for a healthy individual, it's really no big deal, you know. But in his case, his comorbidity was obesity, diabetes. He also has varicose vein, so vascular insufficiency, and he has a sedentary lifestyle. So as a result, he end up with delay. What normally should have recovered maybe in just a couple of weeks and being able to go back to work pretty much immediately, right? Is that it end up with delay wound healing, wound infection, end up with thrombosis because of the vascular insufficiency, and then we have to use hyperbaric treatment for his wound, prolonged disability. He did not go back to work until 6 to 8 months later. Okay, so we understand the impact of all this, right? So as far as burden on our healthcare system, just really quickly is, we know there's the adverse outcome, and the increase of the disability and mortality and overutilization of resources. Study have shown that 6 in 10 there's as far as poor outcome, you know, there's the economic burden. Look at the numbers here, okay? Approximately 60% of the US population is with one chronic disease. Approximately 40% of them are multiple diseases. So what they're looking at is about 6 in 10 people, that's average about 6 in 10 people with one chronic health disease. And then with 2 or more, we're looking at about 4 out of 10 people. So look at the money that is spent here. The drug concerned, the use of prescriptions, emergency room visits, right? Okay, so the other thing is burden on the employer. Okay, so there's a lot of research. What I could find is on healthcare. There's really not a whole lot of research and literature about the amount or the percentage what is spending on the diagnostic for the employer. It's very limited information on the employer impact. But I was able to find something here, according to Center for Disease Control, that employer bear a huge percentage of the medical costs. Okay, let alone with the absenteeism, right? So because of one disease, the increase of higher, risk of not being able to go back to work, we may have to pay for treatment of other comorbidities to prevent other injuries. And then on top of that, the impact on claims. So here's what, as far as comorbidity claims for us, when your first comorbidity is diagnosed occur within the first year after the injury, you have a comorbidity claim. Okay, so again, this is older information, and some of you guys may have attended this conference from the 2016, the National Workers' Comp and Disability Conference in 2016, Harbor Health System, that is part of the one call case claims management, had put together this when they did a research about 7,000 workers' comp claims, and then what they have found as far as the impact and how much it has increased when there's comorbidities involved. 341% increase on medical costs, okay? 76% increase on claims duration. These are really, really high numbers, right? When it associated with comorbidities, okay? 67%, let me just go back here, and you could access this information. But about 67% of the claims involving what the research here are relating to substance abuse. 55% are due to obesity-related claims. So let's talk about some of these common conditions that we are dealing with, and then how it's impacted and what we could look out for, okay? So before we do that, here is that gift card opportunity. Adam, are you ready?
I am ready.
Okay, so remember, first person that answers this question correctly, make sure you do type it in. Okay, here we go. Get your fingers warmed up. Okay. True or false? Comorbidity is described as having only one disease or medical condition. Wow, look at that. All right, the answer is false.
I show on my end, Ashley Hamblin.
Congratulations, Ashley. Okay.
Adam, I also confirm that on my screen.
Nice, you guys. Okay. Oh, here's another opportunity. Ready? A comorbidity claim is described as which one? I love this. So much fun. Okay, the correct answer is A.
And Sheila is our winner.
Sheila, congratulations. Okay, there's a few more coming up later. So let's talk about obesity. Obesity is defined as a medical condition which exceeds body fat, okay? And then, of course, it causes adverse effects to our health. It is the greatest, according to all the research and study, it is the greatest impact on workers' comp claim. So, is obesity a disease? According to the American Medical Association and Center for Disease Control, they have labeled obesity as a disease. How do you define disease? The questions are, does it impair normal functioning of the body? Are there signs and symptoms? And are there harm and morbidity? Are you guys all nodding your head? I think you are, right? Okay. Is it a disability? A disability, according to the ADA, is defined as a physical or mental impairment that substantially limit one or more major life activities. What do you guys think? I think we're all nodding our heads as well, right? So a disability, according to the ADA, they kind of look at 3 different components here. First of all, is it a mental or physical impairment of one or more major activity? Or is there a record of such impairment? Or is regarding as having such an impairment, okay? So a physical impairment by them is defined as any kind of physiological or conditions that causes cosmetic disfigurement or anatomical loss affecting one or more of our systems. Well, I think this certainly qualifies for that. So is it a covered treatment? If it's a disease and there's disability, yes, it is covered. And we've spent billions on direct medical costs in taking care of your treatment of obesity. Okay, so, well, how prevalent is obesity? Oh, sorry. Here's the numbers in 2018, and of course, the concern is that approximately 2.1 billion people in our nation are either obese or overweight, okay? And this is expected to increase to 50% of our population by 2030. Well, that's not that far away. And part of the concern, of course, is our lifestyle changes. Worldwide, statistically, is showing that 37% of adults are overweight or obese, and 14% of our children are in this category. Okay, so CDC's identified that approximately more than 50%, look at this, 64.5% of our workforce are in this category as well. So the concern now, sometimes we look at these numbers, job absenteeism in the billions, higher claims costs with people with the BMI index of 40 plus, because that is what is considered as obese. Okay. But sorry, I wanted to emphasize something here is I wanted to just kind of emphasize something that it looks like by these numbers, it looks like people who are overweight or weight challenge workers, they're not good employees or because of all these numbers. But I wanted to emphasize that, of course, that is not the case. Okay, because we also have to look at sometimes it's not lifestyle choices. Sometimes it's because of other health problems or health risks or other treatment that impacted, which caused the overweight problem. Sometimes certain medications of other conditions may impact that, okay? So may cause that as well. So how obesity impact on the body? I'm going to talk about diabesity later on because it is linked to diabetes, okay? But also the impact on our body, cardiovascular, like heart disease, hypertension, cholesterol, stroke is also a concern. It's kind of go hand in hand. The concern with the stroke is because when there's cardiovascular problem and there's circulatory problem, then it may run a higher risk of an individual having stroke that is, vasculature related. Okay, of course, stroke could be other reasons, could be caused by other things too, but that is a high probability. Okay, so osteoarthritis, our body is not built to carry these kind of excess weight. It's just imagine carrying another 50 or 100 pounds on your back and just feel that load on all your joints, right? So arthritis is one of them. Gastric reflux, okay? Again, all that pressure, all the load, sleep apnea, respiratory problems, musculoskeletal problems, liver and gallbladder problems, essentially almost every system that could be impacted. So again, like I said, is it a disease? Yeah, it is, right? Okay, so what about stress and stress response? Study have identified that obesity does have a very significant impact on our immune system, and it actually increase a frequency of infection, delay in tissue repair. So then there's always a concern when you have someone with any kind of wound injury. Okay, so immune responses, stress responses, and also neurovascular. Now, of course, when we talk about stress, and I'm not sure we had to have that in service with this group, but I have another one that talk about stress, and basically is this hormone that is the stress hormone that's flowing in our body is also very destructive to the chronic stress is very destructive to our brain cells and every system in our body. Okay, and then of course the more the weight, the larger the size, increase the weight, the more we have to accommodate as far as making sure that the dosage of medication is appropriate. So there's increased need for more medications. Okay, so how does it impact on claims? Look at all these things that we're going to talk about. Look at the diagnostic challenge, the treatment challenge, and all that, right? So overlapping symptoms, maybe in a situation you have someone who maybe have a back injury or a leg injury, some kind of a knee injury. On top of that, that someone that is overweight, it's going to impact the recovery time. It may take them longer time to recover. Okay, size and equipment and visibility of a diagnostic test. Okay. Sometimes these overlapping symptoms is hard to distinguish which is first and what caused what. The person with a back injury, was it because caused by due to their weight problem and was causing the back pain? But at the same time, it's a bidirectional thing that we're talking about. But at the same time is did the injury, because of the injury of the back and the weight that is delaying on the recovery. So equipment size, sometimes we have to find, sometimes there's difficulty as far as finding imaging center that has, a scan that may be able to fit this individual, or even surgery. The table may not, there's also a concern with that. Also, when you do certain kind of tests, the visibility of the test could be also impacted, because a lot of times you may also see in the doctor's report that they are not able to clearly visualize it due to the excess tissue around the area. So treatment challenge, as I said earlier, there's delay in treatment. There's also concern with increased hospitalization. They're already deconditioned to consider this. They already may have a sedentary lifestyle. They may already start with deconditioning to begin with. So rehab may be a lot more challenging. Okay, it may take longer. Pain management is always a concern. Again, it's difficult to have adequate pain control when the body is, when the body's take on so much load. Surgery concern, the amount of anesthesia that needs to be used, the length of the procedure because of the size, and also, again, the equipment or the surgical table. And then there's a lot of post-surgical concern as well, based on what we said earlier, all the system that's involved, okay? Cost. Then you may incur higher costs, increase longer disability time. Sometimes you may, and I'm sure you're all nodding your head here as well, is sometime we may have to pay for a weight reduction program before the doctor would treat something or do surgery on something. Okay, so at that time, we end up being responsible for that. And there's also concern with secondary complications, increased length of stay, increased duration of therapy, other coexisting concerns. Okay, so we're going to talk about the diabetes concern, okay, elevated blood sugar, circulatory insufficiencies, like I was saying earlier with that bus driver. Okay, and it's not just tissue repair, because there's also concern about blood clots, pulmonary embolism, and again the polypharmacy. So it's just, I just want to share this case with that we're dealing with right now, actually, with an individual who was actually hit by a vehicle. Okay, he's a pedestrian. He was delivering something. He got hit by an oncoming vehicle, pretty significantly, resulted in fracture of his spinal cord, pelvis fracture, multiple injuries. But the difficulty, the challenge is he is already, as far as obesity, he is already overweight, but he does not see any doctors. He's never seen a doctor. Okay, so there is no primary care doctor. There's no pre-documentation of what other medical condition that he has before. Subsequent to this injury, because of a spinal cord injury, he wasn't able to be mobile. And on top of that, he already had a sedentary lifestyle that he has gained over 100 pounds since the injury. So this individual now is 400-something pounds. So just imagine all the the therapy, the treatment, and on top of the additional weight reduction now that we have to provide. So diabetes is a metabolic disease, and is usually associated with some kind of defect in the insulin secretion or the utilization of insulin. Chronic hyperglycemia, with the concern is that it causes long-term damage, okay, of all the other vasculature organs. So diabetes is really common, affecting more than 100 million Americans, 1 out of 10 people. Most people don't even know that they have diabetes. Usually that's associated with type 2 diabetes. And medical expenditure, again, is 2 times higher. 69% people are also with hypertension and with high cholesterol. And then the direct cost, again, is in the billions. Okay, so we know all this number here. So here's the codependency that I was talking about, the diabesity relationship with obesity and diabetes. So while obesity is the major cause driver, okay, and for diabetes. Now, that's not to say that people who are overweight will that's will always have blood sugar problem or will always have diabetes. That's not true, okay? Or vice versa, you know. It's like people with diabetes is always overweight. That is not what we're saying, but there is definitely a strong correlation to it. And the concern, of course, according to the International Diabetes Foundation, is that diabetes is one of the biggest public health challenge, and because of our lifestyle changes, and in fact, during the last 2.5 years in the pandemic really did not help at all. I am sure all of us at one point or another have put on some pounds because of the pandemic. It's just number one, the changes in our lifestyle over time, the convenient food, right? You know, the frozen food and all that stuff that's really unhealthy. But at the same time, look at the last 2 years, how easy it is. We have delivery for everything, for our food, for things that we want to buy. You know, they could deliver to our home. We just really don't even have to go out anymore. While it's convenient, it really doesn't help to add more pound to the nation. So typically it's type 2 diabetes. About CDC estimate about 80 to 90% people with type 2 diabetes also have obesity. Okay, so there is some direct, pretty strong direct link, but I just want to caution that it's not always the case. Okay, so again, there's some pretty strong link to it, and what it was saying about how it links to obesity and diabetes, and it becomes a vicious cycle, as you see in this infographic here, is what happened is that insulin resistance. So our body become more resistant to using the insulin efficiently. So then what happened is then there's a buildup of blood sugar in our body. And when these blood sugar are not being burned up or used, it actually gets stored as fat. So then more fatty tissue, the less sensitive it is for our body to use insulin. And so hence for this vicious cycle. And that's why there's a commonality to it. Okay. But again, we don't want to always, you know, it's not always a lifestyle choices. While there is a strong link to it, I want to again emphasize that the common grounds between diabetes and obesity, and sometimes it's not just lifestyle choices, okay? Sometimes it's also genetics, sometimes ethnicity, sometimes because of age and other disease process as well. So how does diabetes impact our body? Again, with hyperglycemia, the high blood sugar, or low blood sugar is always a concern, okay? Atherosclerosis, that impact the heart, the blood pressure, again, the concern with the stroke, right? So that is the buildup of the plaque in the arteries, and then with that in time, it also causes hardening of the arteries. Anything in our system that have highly vascular blood vessels or vasculature will be impacted. For example, like the kidney, the liver, the nerves, that the peripheral neuropathy, sometimes you guys hear all the time, is also impacted the nerve endings, okay? So remember that a lot of times if you have individual who is complaining of maybe any kind of nerve-related injury, for example, maybe like carpal tunnel or tarsal tunnel, or anything that may have impact on complaining of numbness in their hands or whatever they may be, you always have to think about what maybe is there other comorbidities involved. Because, for example, if someone who has diabetes for a long time and is not well maintained or well controlled, or like my injured worker who has never seen a doctor, and we hear that all the time, no, I didn't know I'm a diabetic, you know, because I never see a doctor, that kind of stuff. And so you want to really kind of look at it and say, well, let's think about, are there other conditions that may be the source of what this person is complaining about, any kind of neuropathy, you know, because is it really truly carpal tunnel, or is it because this person is a diabetic and has peripheral neuropathy? Okay.
Angie, we have a quick question.
Yes, thank you. I'm not paying attention to it.
If a person is born with diabetes, is it type 1?
The person born with diabetes, yeah, so usually, yes, thank you. So type 1 diabetes is defined as the body actually does not produce enough insulin, whether it's because of genetic sometimes it's because injury or illness to the pancreas. Okay, so yes, so type 1, you could born with type 1, it usually is type 1, yes. So type 2 diabetes, and that's not that's not really a high percentage actually. People that are type 2, actually about 90% of the population is type 2 diabetes. And sometimes you hear the term adult onset diabetes. Is usually accompanied by, because as we age, our body either not producing enough insulin or our body is not using the insulin efficiently. And sometimes it's lifestyle choices as well. So there was something I wanted to say about that. Oh, so in workers' comp though, if you have someone who, let's say, got hit by a truck, abdominal injury, and the pancreas is injured, this person then will end up with a type 1 diabetes, because then now the pancreas are not able to produce insulin. Then but that's on us then, right? Does that make sense? I hope I answered your question. Okay, so the other thing that's highly vascular is our eye. So the glaucoma, the retinopathy, and things like that. And again, if someone is complaining of an eye symptom, you are, again, a red flag. Are there other comorbidities? Okay, study have identified that with diabetes, you have to look at two things. There's macrovascular changes and there's microvascular changes. And some of these microvascular changes could damage those small blood vessels and also impact on maybe the brain. So there's study have identified that there's been a 9-year study that identified that may impact on early signs of dementia. Also, they're still doing some study. There's really no long, like definitive proof, but there may be some kind of association with that. Okay, how is diabetes impact on claims? Diabetes impacted by delaying in soft tissue healing because, again, the vascular involvement. Increase the risk of infection, okay, because poor tissue healing. Decrease sensitivity to pain. We wish is decrease. Increase sensitivity to pain. So that means if you have someone with diabetes, they may have increased pain, and then you may end up with also some chronic pain concerns. Increased risk of neuropathy, okay, the nerve involvement. So that is why the coexisting, meaning it's happening at the same time, these symptoms is sometimes difficult to separate, okay, because you don't know which is first. In someone who, is someone who never seen a doctor or is not in good control of the blood sugar, and then it interferes with wound healing. You have someone with a back surgery and they're not healing, but sometimes it's difficult. Are we going to ask the doctor, can you separate, can we separate what is industrial, what is non-industrial? Sometimes that is going to be difficult, okay? So an injury or treatment may also exacerbate diabetes. For example, you have someone, let's say we know that this person have diabetes. This person with a back injury or a knee injury, and the doctor is requesting a series of epidural injections. So epidural injections are with steroids, okay? So what happens, steroids actually increases blood sugar. So that could be enough. A series of epidural injection could be enough to throw someone off the blood sugar level. And then now they need to increase their insulin. Who's responsible? Maybe us. You have someone who has a catastrophic injury, been healthy all their lives, but would have a catastrophic injury, and they're pumping this person with a whole bunch of steroids to just keep the system, from the inflammations, and maybe, with a brain injury, they're going to keep them calm, and they're going to pump them up with all these steroids. Again, that's going to throw off their blood sugar. So a lot of times when you have a catastrophic claim, don't be surprised that you end up with them. Wait a minute, I didn't know this person's a diabetic. You see it on the chart. Why is he on insulin? Okay, why are they monitoring his blood sugar? This is the reason. It could be a temporary situation. When they're off the steroids, with these large doses of steroids, the blood sugar may be under control. But sometime maybe not, because that might be enough to just kickstart and mess up the system. And then now they're forever needing to monitor the blood sugar, or either some kind of insulin or anti-hypoglycemic medication.
Angie, we have another question.
Yes.
Do medications for pain interfere with diabetes or have an adverse effect?
Yes, it can. Yes, it can. Any kind of medication can have so many side effects, and not just on the condition. Sometimes what we call is one medication could exacerbate an existing medical condition, but at the same time, certain medication could also cause the effectiveness or the effect of another medication. So there's been some link that it may increase, again, like here, right here it says, may need to increase diabetic medications, or certain pain medications the side effect may cause increased blood sugar. Okay, so it just depends on what kind of combination that they have. Now, on top of it, if you're diabetic and you're sick, you have an infection, you have a cold, you have a flu, you have COVID, whatever it is, your blood sugar will go up anyway. So stress may cause the blood sugar to go up. Okay, so consider your injured worker that have already an injury, but have a comorbidity condition of diabetes. You're going to guarantee that those blood sugar is going to go off. And the thing to watch for is that I always advise my injured worker, check with the doctor who is managing your blood sugar, and just to double check it, making sure everything is okay. Kind of just having them to just double check that, because if they don't double check that, it's again that vicious cycle, right? You got a work injury, blood sugar goes up, but if they don't check it, the blood sugar is not in good control, then it's also going to impact on the recovery of the work injury. Complicated. Now, cardiovascular disease. Disease of the heart, blood vessels, okay? Coronary artery disease, high blood pressure, congestive heart failure. Arteriosclerosis is the plaque that's built up in our artery, and then it causes blockage, okay? So dyslipidemia. Dyslipidemia, okay. Abnormal amount of lipid or cholesterol, that's the fat, okay, like the triglycerides, the cholesterols, and all the other fatty lipids in our blood, okay. So, of course, it increases the risk of cardiovascular diseases, and usually with that condition, there's no symptoms in the beginning. That's why it plays a central role to our heart disease. Still the leading cause of death. Heart disease is still the leading cause of death as the last time I checked it, like yesterday. Okay, cancer is number 2. COVID have took the place of number 3. Okay, and then number 4 is accidental, unintentional harms. Okay, so heart disease still number 1. Leading cause of stroke is a concern, like I said earlier, because of the cardiovascular problem. And the stroke is a leading cause of permanent disability, about 75%, affecting impact on employment. High blood pressure, when the blood pressure is above 130/80, it is considered high blood pressure. Now, it could be hereditary, it could be a cardiovascular disease, it could be stress related, it could be a lot of things, okay? Ideal blood pressure, you really want to keep it lower than 120/80. So just kind of trivial information there. And the stress, like I said earlier, stress raises blood pressure, elevate cholesterol level, and then all that stress hormone, your cortisol, your adrenaline that's floating around is unhealthy. Chronic level of these stress hormones are unhealthy for our body. So how is it impacting on pain as far as cardiovascular? Again, interference in healing, because there may be blockage or that interferes with the circulation of those healthy bloods, right? So delay in healing and prolonged swelling and edema. So for example, if you have someone who have a cardiovascular condition, usually that accompanied with some kind of vascular insufficiency, okay? So, and if especially when it comes to like a lower extremity injury or anything like that, if the circulation is not there, it's not a healthy system, then it does affect with swelling, and then it will delay in terms of recovery. Anyone with a history of cardiac problem, there's always a surgical risk. We always really, really want to do a cardiac clearance. So then that is something that it would be helpful to know ahead of time. But usually, the doctor who's doing it kind of have some idea, and there are definitely some red flags that they would request for surgical clearance. I had a guy that needing an ankle surgery. I think it was an ankle fusion. But we also learned that he had a couple of strokes, okay? He had also a heart transplant. And so this ortho is requesting an ankle fusion. It is not a necessary surgery. It was the purpose of the fusion was just to help reduce this person's pain complaint, okay? Because the ankle already healed a long time ago. Okay, so this one, we requested a cardiac clearance, right? In addition to a medical clearance. So this cardiac doctor who did the clearance is going to say, well, because of his cardiac transplant, I will not clear him unless you could assure me that during your ankle surgery, you have a cardiac transplant team standing by. Wow. There is a greater than 40% chance that this guy's heart is going to give out, and you may need to do another cardiac transplant. Okay, like that doesn't even make sense, right? So we didn't do it. Thank God the surgeons withdraw the request for the ankle fusion because the risk outweighs the benefit. Increased risk of bleeding, especially those that are already taking some kind of blood thinner, or even excessive amount of anti-inflammatory. Anti-inflammatory has a blood thinning agent. If someone's on anti-inflammatory and on a blood thinner, this is a double whammy. That means they have a higher risk of the bleeding out, okay? So something else to look for. You have somebody who has been taking anti-inflammatory for a long period of time, longer than they need to because of a work-related injury. And then we later find out, oh my God, this guy's on a blood thinner. And this is sometimes you won't know, right? You don't know about all this stuff. Now, sometimes maybe a case manager may pick it up because we ask everything. What kind of medication are you taking? Work injuries? Medication taken from work for work injury, what other medication are you taking? Because for us, looking at the list of the medication, for a nurse looking at it, you're going to be able to tell. All medication has to have a diagnosis associated with it. So if I see someone that is on Coumadin, why are you on Coumadin? Bam, it's just one thing opens up another. And that's why in the beginning, I'm saying, did I open up a Pandora's box, right? Risk of blood clots, same thing, blood bleeding out, but also the higher risk of blood clot. This is another thing that we look at post-surgically is, again, sometimes the doctors don't tell them when they leave the hospital what to look out for. There's so many times that when after surgery, and I call the injured worker, and even the back surgery, and I say, how are you feeling? Anything? Do you have any pain anywhere? It's like, yeah, my leg is really swollen. It's red. It's really painful. It's like, oh, holy moly, this guy got a blood clot. Okay. All right. Prolonged medical and physical recovery increase, and may also risk of increased hospital length of stay. So obviously, in a short hour, I'm not going to be able to cover all aspect of comorbidities, but I do want to hit some other section as well, as far as musculoskeletal. I cannot talk today. Okay, musculoskeletal injuries, what they interfere with. Okay, pain, mobility, maybe more therapy, especially if they have like arthritis, history of arthritis, or I'm trying to think of like a musculoskeletal condition, but it also could be maybe they're born, let's say, maybe they're born with certain kind of physical limitations. Okay, that's going to interfere with it. Sometimes the durable medical equipment as well. Neurovascular, okay, they have a pre-existing neurovascular condition. It may be, we don't know, maybe someone who may have some kind of cognitive impairment. Let's say someone who had a mild stroke in the past, that may interfere with some of the cognitive functions. Or peripheral or central nerve recovery. Pain management may be an issue. We said earlier, especially when it comes to maybe like even diabetes, right? They have increased sensitivity to pain. Okay, so sometimes you can also think about many of these comorbidities. It's like a bidirectional problem. Okay, because again, their condition may impact on the recovery of the work injury, but at the same time, maybe the work injury may accelerate or exacerbate the pre-existing condition, and now we may have to deal with it. Okay, same thing, pulmonary. Okay, interferes with. They have a pulmonary problem. You may have a concern about what kind of anesthesia that you should use, or how long of that. The length of procedure may be a concern. Physical tolerance when they have therapies, or anything like that. Post-surgical concern because of the pulmonary problem. They may end up being, staying in the hospital longer, or maybe, of course, compromised immune system. History of gastrointestinal problem may interfere with medications. I have a lot of patients that, or injured worker that tells me, I can't take these medications because I have gastric ulcer problems, or I have a very sensitive stomach. My stomach can't tolerate these anti-inflammatories or these pain medications. And then if the pain is not well controlled, then it's going to say that they're going to have complain about delayed recovery because they can't do therapy because they're in too much pain. They can't go back to work because they're in too much pain, but they can't take medications to help them with their pain, right? Okay, so concern with also drug interactions, mental health associations, because I'm going to talk a little bit about that gut-brain theory, how this is associated with it. There's also concern about malnutrition, malabsorption. There's also, I wanted to emphasize a little bit about the lifestyle choices, because they do interfere with a lot of the work injury. Vasoconstriction associated with smoking. Someone who smokes a lot, the blood vessels actually constricts. When the blood vessel constrict, it interferes with circulation and tissue recovery. Okay, so sometimes there's a concern about tissue hypoxia, not enough oxygen to the tissue, increased risk of infection, again, delay in tissue or bone healing, and there may be physical deconditioning. Oh, gift card time.
We are ready, and we have a question too.
Yes, I'll go ahead and answer the question first.
Could a head injury or concussion aggravate comorbidities?
So much. I cannot even cover. I can't even go into head injury because there's so much in brain injury. Number one, the medications that they're on alone may exacerbate or a pre-existing condition. Okay, because of the type of medication they're on, a lot of it is maybe some kind of steroid medication, pain medications. There's also medications for anxiety, depending on the severity of that brain injury. Brain injury in itself, okay, may have some impact on it, even though it depends on the different part of the brain. So, and then of course, depend on the source or what was the cause of it. So yeah, it does.
So I'll
Maybe next
apologize.
time we could
That
talk
wasn't the
about,
quiz
maybe
question.
next,
People were answering the quiz question.
yeah, I'm
But
sorry, Adam, what was it?
no, people were answering that as the quiz question, so I want to apologize. The quiz question is coming now.
Somebody give you an answer before the quiz has popped out. That's pretty
Well,
cool.
I'm going to give Christina Smith a gift card because she was the first one to answer the question we just asked. So congrats.
See, that's why I also pulled these slides out of the handout. So you don't know when that's going to pop up. Okay, ready. Which metabolic, hint, comorbidity condition interferes with carpal tunnel claim? Good job. The correct answer is diabetes because that is a metabolic disorder.
Nicole Johnson.
Okay, congratulations, Nicole. All right. I'm going to have to wrap this up really quickly. Psychosocial.
Yeah, we have just a couple minutes, Angie.
Yeah. Okay, let me talk about this really quickly. Psychosocial. Okay. 29% with medical condition, because sometimes we don't think about this. Psychosocial, history of psychosocial mental health problem could impact on your claim. Okay, so 20% of the population have experienced some kind of mental illness. Gosh, that's pretty scary. Okay, this is pre-pandemic number. Okay, about over 50% of mental health illness do not receive treatment. Okay. Our current state of mental health is a disaster. It's already bad to begin with. On top of it, now with COVID, it's even worse. But consider when an unexpected injury, as in workers' comp, happens, the collateral damage, because it's not just the physical injury itself, okay, because it also creates anxiety. And if there is coexisting mental health condition, you could guarantee that's going to compound the entire situation, okay? So depression and anxiety, increased duration of the claims. 7.1% of the US population with depressive episodes. Look at that, okay? Concern with substance use disorder, all right? And also any kind of psychiatric or personality disorder. Look at those numbers of those billions of lost earning. The psychosocial that impacts on health. Okay. This is that bi-directional thing that I wanted to just talk really quickly about, is that when there is that psychosocial problem, there's always some link to the physical health as well. Okay, and so that's what we call the bi-directional. And sometimes, let's, for example, your brain injury case, you have a brain injury that impact on a lot of the the body functions and whatnot stuff. Don't forget that there's also that mental health component. We've come across some brain injury cases for whatever reason, what that may be. We think that they're doing fine, and they end up going home, and then they kill themselves. Okay, so general impact as far as mental health: weakens immune system because of the stress hormones, prolonged inflammatory responses, risk behaviors, increased use of substance use, okay? And the psychotropic medications. Psychotropic medication causes weight gain. Oh lordy, okay? And then there you goes your weight gain, your obesity, and then the impact on diabetes. Okay, affects self-management and compliance because of the psychosocial issue, or maybe the personality disorder, okay, associated with other health, other physical related issues. That is it work related or not, or is it because pre-existing? Which comes first, right? Okay, so how is it impact on your claims? Is think about the depression and the chronic pain and the impact on that. Okay. 50% with chronic pain have some degree of depression, increased prescription drug use, more frequently diagnosed following an injury. If there's already a pre-existing history of depression, it's going to come up again. other health-related illnesses due to depression. And again, if the psychosocial could exacerbate other conditions. So there's so many correlation. That's why we're saying like the comorbidity part of it is so important. And again, the risk of drug overdose, if they're taking medications for, they have a history of any kind of mental health problem and they're taking medications already, and then they got a work injury and the doctor prescribed them opioid, there's always a risk with benzodiazepine and opioid. How its impact on claim: your substance abuse, increase drug use, and then increase your expenditure, okay, miss work, polypharmacy, delay in returning to work, statistics show 3 times longer, and the risk of mortality, okay? Of course, with pain management issue, prolonged hospitalization. Then sometime we may end up with, then we have to pay for the detox. Well, this whole thing is that we can no longer ignore the fact that say, well, we don't want to know about comorbidities because it's not a problem. We can no longer like put our head in the sand and say, I don't see it, it doesn't exist. Okay, so wrapping it up, your claim strategies. You have a lot of tools that you could use, whether it's your pharmacy management system, your peer review, your UR, claims management, as far as identifying those early identifying of comorbidities. And so by the way of doing that is your increase, your employee contact, building that relationship, and determine the need for secondary, opinion. Find out about, if you can, just in the course of conversation, you may know, what are the complications that you may have and anything like that. Really the emphasis is on that claimant center approach. Okay, I know there's a lot of discussion that in our industry, but it is really important. We just have to ask and get to learn about the information. And then you need to then calculate additional money in your reserve. Your case management that's available to help you, okay? The more comorbidity you have, more complex that claim. Early case management intervention is helpful because you may not have time to ask those questions, but the case manager may be able to ask those questions and identify those for you. And then sometimes there's certain case management company may also use the predictive modeling software. That sometimes is helpful, but it's only limited information as well. Now, take in consideration that your UR really doesn't use too much of that, your client center or the predictive, they use primarily to predictive modeling, but it's based on the software and what they see in writing in the report, right? Sometimes if the doctor don't say anything, you might miss something. So close monitoring is important. Getting them to comply with their treatment is important. And you may need to, how to appropriately coordinate with other specialists and how to separate that industrial versus non-industrial. Encourage the employer to get more involved. And like I said earlier, if they could be more proactive, to assess that with their injured worker. There's a lot of conversation about injury and illness prevention program, and it does help reduce injury. Okay, providing workplace wellness program, injury prevention, getting the employee involved, safety training, or anything like that. I think this is the last gift card. Here we go. True or false?
All
Answer
right.
is true.
Jasmine.
Congratulations, Jasmine. I think one more. Here we go. Last one, which is not a claim strategy that we discussed. Yeah, you got it. C, early claims denial.
Sherry.
Sherry, congratulations. All right. I'm sorry, long COVID. That's just, I'm not going to go talk too much about it, but that's always not, it's a new concern, right? But think about the comorbidities and COVID, and primarily the long COVID, because people that have recovered from COVID, statistically is suggesting that 30% of those people may end up with long COVID, and sometimes it may last about 6 months or more. It's still too early for us to tell, but Remember that it is a claims challenge, and ADA is considered that need to have provide reasonable accommodation. So in summary, look at the risk factors, consider the duration, the changing culture, claims management approach, okay? Sorry, we kind of run out of time, but I hope you find this helpful. Thanks again for the information. Thanks again for the opportunity to share this information with you guys. Let me stop share my screen, then you could talk.
Oh, you can leave it up, Angie. Just leave it up. So this is Diane Cohen thanking Angie and Adam. Adam, you want to pop up for a second? Say goodbye to everybody.
My camera's up. Thank you so much.
Okay, very good. So we just want to thank you for joining us for another edition of MacroPro and Friends webinar series. Please check the MacroPro website at macropro.com for any and all upcoming events. Until the next time, thank you very much. And remember, when you need records, to call on MacroPro. Bye-bye now.